Hi, I am Dr. Felice Gersh. I'm an integrative physician located in Irvine, California, and I am doing a regular Instagram series to help every one of you navigate this very strange and very frightening time, the era of the coronavirus. Today, we're going to talk about the role of fitness and exercise, how you should do it, when you should do it, and why you should do it. But before we start, I just want to mention one thing. Many of you probably are or know people who are on the pharmaceutical called Metformin. And some of you are looking at taking potentially hydroxychloroquine, the medication that is used for certain autoimmune diseases like lupus and rheumatoid arthritis, but now has been proposed as a potential therapy for people with the coronavirus when they get infected. So I just want to let you know that there's been now a study that came out that showed that if you take the drug metformin along with hydroxychloroquine, there may be serious complications. Now, in a future Instagram Live, I am going to discuss all of the latest updates on pharmaceuticals and other treatments for the coronavirus infections. But for right now, I just wanted to mention that before we delve into fitness and exercise. So, of course, you don't need me to tell you that staying fit matters. Of course, it matters. But why is it especially important for you to keep that in mind when you're trying to prevent? This is all about prevention. That's what functional medicine doctors excel in. And then we also deal with treatment. But we always want to do the first thing, prevent the serious infection. I want you to prevent getting this infection, but you already know, wash your hands, keep your distance, and now wear a mask wherever you go, right? And so when you're out in public, everyone should now be masked. But we've been advocating that for several weeks. So we're going to try to prevent you from catching this virus. But what if you do? We want to make sure that your immune system is optimized. Being fit and getting regular exercise is tremendously important for having a healthy immune system. When you exercise, certain things are activated in the body that are highly protective. What happens is you immediately mobilize many of your immune cells, and they are out there looking for action. They are there to protect you. So actually, exercising is a mobilization, activation of your immune system in a very beneficial way. So knowing that, when should you optimally exercise? Well, I'll take exercise anytime you give it to me, whatever time of day. But if we want to know what's best, best is in the early part of the day. I don't know if you know this, but your immune system is on a circadian rhythm, as is everything in your body. Everything works on a timer. The 24-hour rotation of Earth on its axis sets everything in motion, not just the Earth, but every cell in your body, including your immune cells. So you have a very different immune cell system at night and in the day and at different times of the day. You may have even heard of this. They call it now chronotherapeutics. Like the time of day that you have surgery or take a medication actually matters. Well, the time of day you exercise also can make a difference. Your immune system is most robust in the morning. Now, people who have rheumatoid arthritis kind of figured this out because their joints, their finger joints, are most painful in the morning. The immune system is revved up in the morning, ready for action. Now, everything is based on survival, evolution for survival. So if you think about it, in the morning, if you look at our ancestors, going back thousands of years, they would wake up in the morning, leave their cave, they would leave their tent, their shack, whatever they were living in thousands of years ago, and they would go out looking for food, right? And then they would go into their different activities of the day, and they would be very active in the morning. So that's when the immune system is most active, in the morning, to protect you. So if you exercise in the morning and you activate your immune system, it will be primed for action for the rest of the day to protect you if that coronavirus tries to make its way into your body. What else does exercise do? It actually increases your production of inflammatory protective cytokines. These are the inflammatory protective cytokines that when they get out of control, which is a whole different thing. When they're out of control, like when people have a cytokine storm, they can be destructive. But that's not what we're talking about. We're talking about their protective mechanism. That's what they evolved to do, to protect you. So if you exercise in the morning, and we'll talk about what kinds of things you can do, that will actually mobilize your immune cells into action, being ready to fight, to defend you. As well, they will be able to make those cytokines, that's like their special sauce that acts to kill the invader, and to not only do that, to call in the troops, the other inflammatory cells, to protect you. That's the incredible inflammatory response that we have in our bodies. But what about many people? Their inflammatory response is out of control. They are chronically inflamed. People who have obesity, the belly fat, that is so infiltrated with immune cells that are actually misprogrammed, and they are chronically creating these inflammatory cytokines. So people who have obesity, this central obesity, they have chronic, unrelenting, low levels of inflammation. Diabetics, people who have coronary artery disease and other atherosclerosis, that leads to potentially, heart attacks and strokes, where their immune system actually is activated within the walls of the arteries, creating unstable plaque. That is what kills people with heart attacks and strokes. That is a terrible thing. Now, we can actually help reduce that. Now, why is that important? Well, number one, of course, I don't want any of you to have heart attacks or strokes, develop diabetes, because not only are they risk factors for having bad outcomes if you get infected with the coronavirus, but they're just bad in general. They will potentially increase your mortality. But right now, in this era of the coronavirus, having chronic low levels of inflammation increase your risk of death, increase your mortality rate if you get infected. Now let's think, why would that be? Why is having this low-grade chronic inflammation so bad? Well, your immune system is dysregulated. It's putting out these inflammatory cytokines, but not for a good purpose, okay? It's creating this inflammatory response that's affecting all the organs of your body. Like you'll have an inflamed liver that leads to fatty liver, another dangerous condition, like I mentioned, in your arteries. And how about in your brain? You can have neuroinflammation. That's linked to things like Parkinson's disease and Alzheimer's disease, dementia. But in the short term, those are like long-term things you may think. But in the short term, when you have a dysregulated immune system, when you have that virus trying to invade your body, your immune response is inadequate. You are not good at defending yourself. That's why, for example, when people have diabetes, they're more likely to get serious infections that don't heal. You've probably heard of that. They can have wounds that don't properly heal. They're more likely to have pneumonia and die from it. And of course, that's what people with coronavirus are having. They're having a type of pneumonia that is killing them. But that's not all. People with the coronavirus infections are getting inflammation in their heart muscles. We now know that. In their livers, in their kidneys, all of these organs are affected. So, how does this link to exercise? Exercise helps lower chronic inflammation in your body, helping your immune system to function optimally. This is not little. This is huge. Now, this is not the only thing. We've talked about nutrition, having antioxidants and polyphenols. It all works together. I don't want you to pick one or the other. I want you to pick it all. I want you to survive. What do you think I'm here for? I'm here to help you and everyone you love to get through this era of the coronavirus intact. Okay? I can't tell you about your finances. That's not my specialty. I don't know if you'll go broke. I want you to be alive, because then you can rebuild, right? You can rebuild, but you have to be here and you have to be healthy. So that's why you are going to start exercising. Exercise improves the function of your immune system. That is not questionable. What else does it do that's also in relationship to your immune system, but otherwise has other benefits? It's now been shown that exercising improves The gut microbiome. You've heard of the gut microbiome, I'm sure. All of those microbes that live inside your gut, you get increased diversity of the gut microbiome when you exercise. How fabulous is that? It turns out that having diversity of microbial populations is key to having functionality of your entire body. It's important for maintaining your proper circadian rhythm, for maintaining a healthy liver. And we're going to talk in the future about the liver. The liver is key to having a healthy outcome with this virus, okay? Most people don't know anything about their livers, but I'm telling you, we're going to talk about that in the future, why you must maintain a healthy liver. But part of maintaining a healthy liver is maintaining a healthy gut microbiome, which is aided by exercise. How fabulous is that? Another thing that exercise does, it helps increase your body's production of a very potent redox signaling agent, antioxidant. Redox meaning it's involved in reduction oxidation reactions in the body, and it's an antioxidant. And we're going to talk much more about this in the future too. I'm going to do a whole program just on this particular gas called nitric oxide. So you're going to learn much more about nitric oxide. It's your best friend. You just didn't know it. So nitric oxide is increased in production by exercise. How is that amazing? So now that you know 100% that you must exercise, what should you do? Well, the standard guidelines from the American College of Sports Medicine, and this is also in agreement with the American Medical Association, and this is about adults, kids need more, but should have 150 minutes of exercise of a moderate intensity every week. So that comes down to about 30 minutes for 5 days a week, okay? But you can do more intensive exercise, what we call like high intensity exercise, for less time if you actually do that. But please don't start with it. If you're out of shape, you're a couch potato, don't start by doing high intensity interval training because you will probably get hurt or maybe even worse. So, yeah, and that I recommend only should be started under the guidance of a knowledgeable, highly trained sports medicine fitness specialist, okay? Like we have Bob in my office. And by the way, he's going to start working with my patients and any of you who want to be. He's going to start doing at-home exercises. So I am just the beginning of what we're going to be talking about down the road with exercise. Bob is going to actually do demos. So, and that's not my specialty, is doing demos, but he will. So, but let's talk about what you need. I already mentioned you need 150 minutes a week of moderate. So moderate would be like very brisk walking or cycling, or doing things like climbing. If you have stairs, you can go running up and down your stairs. Which brings me to, well, what are you going to do? Well, it depends on where you live. There's a story of a gentleman, and I honestly can't remember if it was in Spain or if it was in Italy. He had one of those little balconies that you see outside the apartment buildings, really a small little balcony. He just started walking up and down that balcony. He had a pedometer on, or maybe it was a Fitbit. He walked the equivalent of a marathon. How is that? I think it shows that determination will help you to succeed, okay? And that's pretty boring, probably walking up and down a tiny little balcony, and hopefully you have a little more at your disposal to utilize for your exercise than just that. So let's start with you're in a small apartment and you really can't get out because of whatever the reason. Maybe it's raining all the time, or maybe you're in a city and it's just not really safe. Okay, then you have to utilize your apartment. Well, you can always do what that nice guy did. You can just walk back and forth, wherever you are. If you have a staircase, just run up and down the stairs, okay? Don't worry about leaving tread marks, okay? We can't worry about the carpet right now. Just go up and down the stairs. Go as fast as you can for as long as you can. Put on a timer. Put on music, and on the one hand, put on a timer on the other to make sure you get in your 30 minutes. And here's the good news. It doesn't have to be 30 minutes at once. So, like, what if you love to just take a walk after a meal? You could do 2 brisk 15-minute walks after, say, breakfast and lunch or dinner. Just 15 minutes of brisk walking twice a day is meeting your minimum requirement. By the way, that's minimum, that's not maximum. So we can definitely do walking. Now, you may be fortunate enough to have a little bit of a home gym. Maybe you have a treadmill or an elliptical machine or a cycling machine. Well, get on it and listen to podcasts. There's so many great podcasts. Or if you just want to do something more mindless, then just listen to pleasant music. Or if you have a TV in front of you, go ahead, and I give permission to watch all the Netflix movies you want. But I have a caveat. I have one condition. You have to be moving. So I've told this to my patients all this past week. If you're home and you just really are just going to binge movie watching, okay, then all right, because, if that's a stress reliever for you, just do it. But you have to stay on the move. That means the whole time you're watching that movie, you need to be walking. You can have if you have the TV in front of a treadmill or a cycling machine, fine, just keep going. If not, you don't have one, you just have to keep pacing in that room. You just pace, you walk, you pace, you walk. And why don't you do a little bit more? Even if you don't have weights, I'm sure you have something you can lift, a statue or some heavy books, and just keep lifting them. You can do that. And we're going to get, when recruit Bob into this, we're going to have him show you some other types of exercise. For example, you can use your arms. If you can sit in a chair that has armrests, you can just try to lift yourself. Use your arms and lift your bottom off the chair seat, okay? Do that 10 times, 5 times a day. That's really good arm exercises, okay? You can do things against the wall. You can also order some different types of these elastic bands that can help add resistance. So we do want you to do aerobic exercise, but we also would like you to do some resistance training. So we're going to get into more specifics, like I said, when I recruit Bob to start teaching you in visual terms what you can actually do. I'm going over the science and generalities of exercise. So we definitely are going to get you exercising, preferably in the morning, but if you can't, then just exercise any time of day. It's always going to be beneficial. Like I said, I'll take it when you can give it. It's least beneficial to exercise right before you go to sleep. When you exercise, you are really activating your immune system, you are really increasing your cortisol production, and that's not really conducive to getting the best night's sleep. And it's not the time of day when your immune system should be truly activated. So it's really not the best time. During the night, your immune system is very different than it is during the day. And, I think this is going to be an interesting topic. I'm going to talk more and more, a whole program just on the immune system and natural killer cells. I'm sure you're really interested in learning about, what are the different kinds of immune cells, what their role is, maybe learning more about inflammatory cytokines. So, we'll definitely do a whole program just on the immune system, so that you'll understand too, like, what does it mean to have a cytokine storm and what can we do to prevent it? But for now, just getting on this exercise bandwagon will help your immune system to functionally optimize itself, so that hopefully if you get infected, your immune system will do its job. We know that about 80% of people who get infected with the coronavirus do not have serious sequelae. If you get infected, I want you to be one of those people, okay? Not one of the statistics with a bad outcome. And this applies at all ages. I don't want you to think just because you're old, you can't do exercise. One of the big differences between older people and younger people in regards to their outcome is really based on the functionality of their immune systems. Older people do not have as robust an immune system. And females have a more robust immune system than males. You probably heard that in the younger age groups, like the 30s and 40s, in general, females are having less severe outcomes. And that's because we females have an X chromosome that's extra. We have 2 X's, and that X chromosome does not get deactivated immediately when we're an embryo, and it actually does reprogram the immune system to be more robust. And even when it gets turned down and deactivated, that extra X chromosome still has about 15% of its genes active that are almost all involved in immune function. So females have quite a different immune system. Females have more immune cells. They make more antibodies. We have just a more robust immune system. And I'm going to do another program on just all about hormones and chromosomes and what makes males and females different when it comes to infections, and why women in general tend to do well, and why menopause is such a bad thing for the female immune system. So that's all, upcoming things. For today, to sum up, exercise is critically important. It really helps improve the gut microbiome, your circadian rhythm, your nitric oxide production, your immune system is improved. Exercise is going to reduce that chronic level of inflammation that you may have. And just another thing that I didn't even mention, exercise improves mental health. Exercise has been shown to be as beneficial as an antidepressant, like one of the SSRI antidepressants. I can mention a couple of brand names like Prozac, Zoloft, Paxil, there's Lexapro, there's a whole bunch of them. Exercise was compared. Exercise did actually better in terms of reducing mood problems, reducing depression. Who's not feeling a little depressed these days? Exercise increases endorphin production. It actually makes you feel happier. And if you can do some exercise outside, the sunlight hitting your eyes, your retina receptors, will increase the production of serotonin, which will make you feel even happier, and then more melatonin at night, so you will sleep better. So if exercise is not on your daily routine, I know from now it will be. So thank you for joining me for this special Instagram Live on how to live in the era of the coronavirus and include exercise as one of your therapeutic modalities to keep you healthy so that you will get through this. So let me take a look at some questions here. Well, this is a very important one. It asks, well, what about wearing a mask? We've just heard that everyone should be wearing a mask outside. So this is what I am recommending. If you're in your own home, obviously you do not need to wear a mask. If you're in your yard or in an area like on your driveway and there's no one around, do not wear a mask. A mask is going to affect how you breathe. So I would much prefer if you not wear a mask while you're exercising. Now, what if you're going out into an area where there are other people? Well, then what I think you might want to consider is finding an area that's really distant from other people and wearing a very lightweight mask. So we are now in the process of selling masks, and I can tell you all the money, 100%, is going to Cookies for Cures, which is funding research for rare children's diseases. So, and we'll be selling these masks. They're $15, beautifully handmade, and they come in thicker fabrics and thinner fabrics. So for exercise, I would wear one of the thinner ones so that you can breathe more readily through it. And, I'd be very cautious to make sure that you do have good airflow when you're exercising. And keep your distance as far as possible if you're huffing and puffing, because we know that that will expel little particles, and if you actually unknown to yourself, if you are infected, but you have no symptoms, you could potentially infect someone else if they're close to you. So if you keep your distance, and nobody knows exactly what the distance should be if you're actually huffing and puffing, but we say if you're doing nothing, it should be 6 feet. So if you're doing something where you're huffing and puffing, like coughing or sneezing, just at least make it double or triple the amount. You have to keep your distance from other people. And in most areas, that is not too hard to do. You can go on the street, there's hardly a car to be seen, and you can really keep your distance. So you can keep your mask with you, but you don't even have to wear it if there's no one around. If you're outside, the coronavirus is going to dissipate. It's not going to be like in a closed room where they've talked about, oh my gosh, if you're in a closed room, and they've tested this, by the way, it's kind of frightening, that in rooms where coronavirus patients were, when they've gone in afterwards and they've tested the air vents, they've found viral particles in the air, suspended in the air. But that's a closed room. If you're outside and you're just like in a street or you're in an area, in a park, you don't have to worry. That is going to be blown apart. Even if there's like a tiny bit of virus here or there, it's not going to be enough to infect you as long as you're far away from someone else. And so, definitely just keep your distance. And so it's optimal if you don't have to wear a mask when you're exercising. But if there's any doubt, wear one of the nice, thin, light ones. Like I've told some of my patients, just stay in your yard. Just run around your yard, or go up and down your driveway if you have one, or go on the street, but try to go at times when there are very few people, and just keep your distance. Have your mask with you for sure, and get a thinner one. So, and here's another important question. What about the risks of not exercising? Because I told you all the benefits of exercising. What about not exercising? Well, you probably heard this. It sounds like a cliche now. Sitting is the new smoking. So if you're sedentary, just sitting all day long, you are growing inflammation in your body. It is terrible for you. It's not good for your joints. You're going to actually atrophy your muscles. You're going to become more inflamed. So here's another rule of thumb. If you're in a sedentary kind of a lifestyle, set your exercising, make sure that you just keep time and just keep going and exercise even when you're working. So like get up, go to the bathroom, walk around, I say go to the bathroom every hour, even if you don't have to. Just go wash your hands every hour. Just get up out of a chair. Don't keep sitting, okay? Sitting is toxic, okay? We are not made for chronic sitting. That's why people have, standing desks, desks that are actually on some sort of a treadmill. Not everybody has that, especially at home, but you have legs, hopefully. Just walk around the house and take breaks from what you're doing if you're sitting. Also, you can think of setting up a computer on a counter, like in the kitchen. So the bottom line is you can do this, stay focused, know the end game is staying healthy, surviving, and maybe even coming out of this healthier than before it even started. So thank you again for joining me. It's been a pleasure. I look forward to seeing you all at my next Instagram Live coming up later this week. Thank you. Take care. Stay well.